Hello, today we are going to be talking about a topic that I keep getting asked to do. It's a little dry, but nevertheless important, and that is the anesthetic machine check. Now, there are lots of resources that one can use to go through the machine check, and no one expects a beginner to memorize this stuff. So however you go about it, find a checklist and just go through it step by step. Now, the Maritzburg department has a checklist for going through the anesthetic machine that is designed for Diploma of Anesthetic learners, which is on your screen at the moment, and I will email this out to everyone. It's actually very easy to use. And then there are videos. So one you'll find on this channel called the Anesthetic Machine Check, that's done by Dr. Garth Horston, and there's another about the airway trolley check. And the nice thing about these videos is the Anesthetic Machine Check is just 12 minutes, and he'll actually show you himself checking the machine, so you can actually see what each step entails. You can also use the ESMOE anesthetic machine checklist. That's what it looks like. It uses a slightly different system, also fine to use, and you can laminate this and put it up on the wall in theatre. And you'll see this one is got a different system about starting up and then going to the wall and then the machine, and then each step is quite nicely written out there. And really, it doesn't matter which system you use. If you are using a system of some sort to go through them, just so long as you get all the basic components covered. Now, the original machines looked a little like this one. This is a Boyle's machine. Now things are a little bit more advanced, and so many of you will be using a Draeger Fabius. Some of you will be lucky enough to have a Primus. Those are the Draeger machines. There are the Watto machines. This is a Watto EX35, quite commonly used in district hospitals. And then there are a variety of GE Medhold machines, like this is a Care Station, but they're actually number of different brands, and one of the problems is that they've got different checking procedures, and I can't cover each machine. So I'm going to go through a system, but remember that your anesthetic machine came with a manual, and most of these machines have drawers in front of them, and if you look inside those drawers, usually someone has left the manual in there, and it's a big fat thing that looks pretty intimidating, but it's usually written in about 20 different languages, so actually the amount of text you have to read is very little. And if you're looking to find something specific out, like how do I calibrate an analyzer or something like that, it'll be in the manual. Many of these machines have electronic checklists now, so they'll actually, as you switch it on, it'll tell you exactly what to do with the APL valve and the gases and everything, and you just follow them, which makes it quite easy. I'm just going to talk to you a little bit about what else you need to cover as well when you check a machine. Now, some of the principles: you should train your permanent staff to check the anesthetic machine. So the people that live in theatre, these are the people that should know how to do a full check, and quite often that's the anesthetic nurse. So make sure your anesthetic nurse is able to do this. Quite often the anesthetic nurse ends up teaching the other members of staff. We've had nurses teaching people how to do cesarean sections when they get skilled. So this is a highly competent individual, and because they're there every day, part of their routine checks in the morning could be checking the anesthetic machine. You need to check this machine even when you're just doing a Caesar under spinal, because think about the situations when you suddenly need that machine. You're converting to a general anesthetic, and often these are time-sensitive scenarios. So hemodynamic instability or high spinal or postpartum hemorrhage, pain, all of these things mean you need to move quickly. So you don't want to add a machine problem to that list, a thing like a big leak, or you don't have a vaporizer. This is a controllable factor. And when you're in those emergency situations, you want the controllable factors controlled. So your attention can be where it's supposed to be, which is on whatever's going wrong. There's then the full check that you want someone to do every day, but there's a basic check before you start in all patients, all procedures, and you do it every time. I'm going to go through that today because I think that's an important part of this. And then the daily full check, which you, as I was mentioning, you can use your anesthetic nurse to assist with. Start of the day, or when you change equipment, like you put on a pediatric circuit or you change the soda lime or something like that, then you need to do full check. So in most busy theatres, we do a daily full check, and then we do little checks as we go through the day. And these machines in district hospitals often lie idle for a while, so they need this full check to make sure everything is fine. Get to know your machine. these diagrams will be in your manual. These things cost over R500,000. They can do a lot more than you realize. And you can learn about these sorts of things when there's no patient in theatre. So when you get that dead time in theatre, use it wisely. And it always amazes me that one could use one of these without knowing, say, how to put the ventilator on. Because if that's you, if you're thinking, well, I'm not really sure about the ventilator, then the time you're going to have to learn it is when you've got an intubated patient that needs ventilating. And it's not easier at that point. So use a test lung, which I'm going to show you a bit later. Learn before you start, before you're in that situation where you need it. Now, there's certain tests that I want you to keep as habits every single time you use a machine. And if all you do by the end of this talk is you're doing these things, you'll be okay in most situations that anesthesia throws at you in terms of the equipment. So every time I anesthetize, I do these things. I check there's power. I check the oxygen cylinder at the back of the machine. I check there's suction that is functional. I check the ambu bag. And I check the circuit can generate pressure. Now, this whole check, in fact, those middle three, the oxygen cylinder, the suction, and the ambu bag, I check once at the beginning of my stage. The circuit pressure I do in between each patient, and it's so quick. It just takes 10 seconds to do this check. So just to go into a little bit more detail, when you're checking the power, you need to know where the light is that says the power is on. And you can see that little green light is there to say you're on mains power. Now, it's quite often the machine is on, but you're actually running on battery power. One of the ways to check it is just to go to the wall, switch the plug off, and then come back and see now what light is showing. But remember to turn the power back on. Make sure you're on mains power and your batteries are charged. Especially in South Africa, we run into power problems. And if the power goes, you've got the length of your battery to wake the patient up, which is somewhere between 30 and 45 minutes. So you need to be sure about that backup. Your theatre might have a backup, a UPS or another system like a generator, but I wouldn't rely on these things. So I always check that the power that light is on, because you don't know if someone's unplugged it to charge their cell phone at the wall. Check this every time. Check the oxygen cylinder at the back of the machine. These things are usually turned off because otherwise they slowly leak and empty. So you have to go around the back of the machine. You have to open the cylinder, the oxygen cylinder. Then you come around the front of the machine and look for the pipe, the pressure in the cylinder, which will read on the screen somewhere on the anesthetic machine. A full one is about 137, but it must be at least 50. And once you've checked that, then you go around the back again and you close it so that it doesn't leak out. And I generally just do that at the beginning of the day. Suction is one of those things you can't make a plan for if it's not working. If a patient starts vomiting and aspirating, the only way to deal with that is with suction. And there really is just nothing else you can do. You can try and turn the patient upside down, but imagine that scenario of the patient vomiting, aspirating, you're trying to intubate, and now you must turn the patient over. So this is one of those things you really just have to get into your habits. So you switch the suction on. You occlude it or bend the pipe so that the suction is occluded, and you look at the gauge to make sure you've got enough suction. And we normally call between minus 30 and minus 50 enough, and make sure you've got a rigid suction catheter, a Yankau, attached to that suction pipe. It's hard to ventilate. If your machine dies, check that you have an ambu bag, check that it works. This is an ambu bag. What I suggest you do is you take it out of that packet that it hangs on at the back of the machine. You take off the face mask and you occlude the end of the ambu bag, and then you just press your self-inflating bag. And you should be able to generate a pressure in that bag. That's all you need to do. Stick it back in the bag behind the machine. And now if your machine dies, at least you can ventilate the patient. You'll be able to suction, ventilate the patient, and you've got oxygen cylinder if you run out of oxygen during the case. Finally, this is the test I do in every single patient. You've got your circuit ready, the APL valves at 0. That's normally how you start an anesthetic. I turn that APL valve to 20 or 30. I put my hand in front of that face mask, so I occlude the end of the circuit. I put the gas on so that the bag fills, and I squeeze the bag. and that's testing all sorts of things. It's testing there's not a massive leak. It's testing that there's gas coming out of your machine. It's testing you know how to use an APL valve, and it's testing that you can ventilate the patient. So that little test, just before I put it on a patient's face, I check that I can generate pressure, I open the APL valve, and I put it on the patient's face. And if you do that, there are so many things you're testing with that little maneuver. You've done more than half of an anesthetic machine check just by what I've told you so far. So those are the things. If you're going to do nothing else, check the power, check the oxygen cylinder, the suction, that there's an ambi bag, check you can generate circuit pressure. And if you do that before every Caesar for spinal, you're a long way to having some sort of reassurance that your equipment's going to get you through the case. Now, you can go through machine check in more detail. And I'm not going to put up what the text of this checklist is. I'm just going to go through some of the points just so that you know what's in there. One of the things they advise is that you check the service history when you do a full machine check. Now, it seems a bit silly to check the service history every single day. The problem is that we never check it. And if you go and look, there's a sticker on the side of your anesthetic machine. It'll tell you when the next service is due. And they should be serviced at least annually. It's a really important service. You don't realize what those guys are doing. So check it. If it's not done, get it done. If it hasn't been serviced, I would probably keep using the machine, but I would try and get that service done. And they're on contract. When you buy these machines, they're supposed to come as part of their contract and service the machines. So it's worth somebody checking this sometime. Check that it's plugged in. It has its own dedicated power supply, and that you know where the start button is and you can press it, and check that when you turn the power off, the batteries are fully charged. We've been through that. I won't dwell on that. The next thing to check is the piped air supply. So there's a central supply that delivers to terminal outlets. These are specific to each gas. They're individually shaped, labeled, and color-coded, and there's a thing called a diameter index safety system. So basically, you need to go to the wall and check that the correct colored pipe is in the correct outlet. They don't fit in the wrong outlets, so they should all be in the right ones, but sometimes they're not seated properly, so you give them a little tug, make sure that they're nicely and firmly attached, and the pipeline pressure is sufficient. They should be about 4 bar. Then you go to your cylinders. We've talked about doing the oxygen cylinder already. You check your cylinder pressure, and finally you check that you've got a scavenging system. Following that, you should check your rotameters. Now, not all machines have rotameters. Some of them have electronic ones. Most of the district hospital ones do, and there's usually nitrous, air, and oxygen. And these rotameters should open easily. They should rise adequately. The bobbins should rotate and not stick. And when you occlude the fresh gas flow, the bobbins should bounce. And you should actually repeat that test with the vaporizer open and with it closed. It's one of the things that tells you there's no leak inside your machine. The next thing you need to do is check your anti-hypoxic device. So this prevents patients getting hypoxic gas mixes. So basically what should happen is when you open nitrous oxygen, the oxygen bobbin should also rise. So it prevents you giving pure nitrous oxygen. And then when you close the oxygen, that nitrous oxygen bobbin should fall. Now we're using nitrous oxide less and less in all hospitals, but if your machine does still have this capacity and you have nitrous, this is one of the tests that you need to do. And then finally you need to check your oxygen fail device. And basically what you do here is you disconnect the wall oxygen, and there should be an alarm on your machine. There should be an alarm that sounds. Some machines have something called a Ritchie whistle. You then open the oxygen cylinder, and the alarm should go off, and the oxygen bobbin should rise. And then you reattach the oxygen pipeline, repeat the tug test, and close the oxygen cylinder. And that's the proper way to test that all your oxygen sources are working. For your vaporizers, they sit on a back bar. And I've just put this picture up here to show you that there are O-rings on those back bars. There's an O-ring there. And the vaporizer must be seated securely and locked onto these this back bar. And if there's an O-ring missing, you'll find that there's a leak at this point. And it's one of the sources of a leak that we sometimes struggle to find. So they go onto this back bar. You then normally you've got 2 vaporizers. Make sure that they're filled, at least half full with the correct agent, and they're ready to use. You test something called the interlock mechanism, which means you turn one on and then make sure the other one is not able to be opened. So they actually prevent you administering 2 agents at the same time. And you'll see on the front of these things, the 2 triangles are lining up there. That's the neutral position. And just to on the right of the screen, there's a little T there. And if you want to transport it, you have to move the marker to the T, which allows you to travel. And that's basically what that is for. So those should be checked. Then you need to check your soda lime, your carbon dioxide absorber. It must be securely in place. Again, depending on the system you've got, these often are a cause of leak. They don't sit nicely, or some of that soda lime gets into the seal. It should be nice and white. There should be ideally less than 50% color change at the start of an anesthetic, which tells you about absorber saturation. Now, you can actually use these for longer than that, but you need to be very confident then that you can change soda lime in the middle of a case. Remember that you can do it. It seals off the circuit, but if you're not sure, rather just change the soda lime. When it starts to get used, it changes color to purple, like that. Now, the other way of knowing that your soda lime is exhausted is just to look at the capnography, and you'll see there that what happens is you start to get rebreathing. So that baseline CO2 during inspiration doesn't go back to naught. And that's basically showing rebreathing, and it's one of the signs of soda lime exhaustion. You're not removing that carbon dioxide from the circuit anymore. The next thing you do is connect the patient's circuit. The circuit should have no holes or cracks in it. It must be connected correctly. It's got a wire piece and a reservoir bag. You then need to do a leak test, and you put a test lung on and you see that you can ventilate with the circuit. Now, an acceptable leak is actually less than 200 mils. When we use the old Boyle's machines in the old days, we would use up to 2 liters. So we accept much less leak now as an acceptable leak. The commonest sites of leak are the circuit, the carbon dioxide absorber, the vaporizers, the bellows, and you need to go and find these leaks if there's a leak. I'll just run through that quickly. So to perform the leak test, you switch the bag or the mode to manual. You check that the APL valve is closed completely, and you press the oxygen flush to get that oxygen into the circuit and raise the pressure to about 40 centimeters of water. Some people do this with 30 centimeters of water. And then you compress the reservoir bag, and the APL valve should actually open at 65 centimeters of water. It's designed to open to protect the patient in case that gets high. Here is another way of doing it. So the wire piece is occluded. You can see it's plugged in. This is a Drager machine. The APL valve is set to 30 in this case. And you can run your leak test like we told you, but actually these machines will do it for you. So you say, I'm going to run a leak test. It then fills the circuit with air until there's a pressure of 30. And then it works out how much air do I need to put into the machine to keep the pressure at 30. And depending on how much flow is needed, that's how much the leak is. So that's the other way of doing this. Some people use the high pressure test, which is what I've explained. You can occlude the wire piece with your thumb, and you flush the pressure up, and then you see how much gas is required to keep that pressure up. And if you are losing gas, you can actually put your ear all around the circuit and around the bag and try and listen for where the leak is coming from. Now, big leaks are worth remembering that there's actually 3 main causes. By big leak, I mean you can't even get pressure in the bag. You've got your flows high, and you press the bag and the air just goes. Those big leaks are worth knowing. Where do I look first? One of them is the circuit. And usually what I mean by circuit is there's a disconnection. One of those limbs has come off. The expiratory or the inspiratory limb has come off. So check your circuit is attached. It's attached to the tube, and it's attached to the machine. Second big one is soda lime, especially if someone's changed the soda lime. It just hasn't been closed properly, or it hasn't been sealed properly. And you can get a leak so big you don't even hear the leak there. And then thirdly, the vaporizers. If a vaporizer is not seated properly, you can have a massive leak at that place where it's seated, and you won't realize it. So those are the 3 big causes of leaks. If you're doing a DA exam, the one they like to do is they put a little piece of paper on the bar where that vaporizer is sitting, and so it just doesn't sit properly, and then you've got a big leak and you've got to go and find it, and it's sitting under the vaporizer, something like that, or they haven't seated the soda line properly. It's usually a nice big leak that you can find and correct. Then you want to attach a test lung, and a test lung is just another bag that you stick on the Y piece. So you put the bag on the Y piece, you close the APL valve, turn up the air oxygen rotameters, and you make sure that you can pressurize the system. Then you turn on the ventilator and you ventilate in the mode that you want. So put it on volume control, once that circuit is pressurized, you should be able to turn the gases right down to minimal flows, and then you ventilate with the mode that you're going to use on the patient. And you can test whether you want to do pressure control or volume control. You can test that the ventilator is working. This is good for two reasons. It's testing the machine's working, tests you know how to use the ventilator. We're almost finished. The next thing you want to check is that you've got your standard monitors. This is usually ECG, blood pressure, oxygen saturation as a minimum. You want to check that your analyzers are working. So there's an oxygen analyzer. Part of a machine check is actually to calibrate this. So you calibrate it to room air, which means that the oxygen will read at 21% or 0.21. And then you check that the 100% oxygen using the oxygen flush is giving you that reading. And each machine has got a way to calibrate it. So what I normally do is just make sure that when I'm giving room air, I'm getting a reading of 21%, and when I'm using 100% oxygen, I'm getting a reading of 100. So I just check that the thing is calibrated. The actual calibration is specific to the machine. You might need your manual. And then check that you've got capnography and that it's working. You can just take the tubing off the filter and blow into it, and you'll see the CO2 rise on the machine. Then you know you've got working capnography. It's a little bit alarming to find that your capnography is not working once the patient's asleep. So the other check for this is that when you've got the mask on the patient and you're pre-oxygenating, make sure you're getting your CO2 trace, because it's a difficult thing to fix once you've started. And then those other things we talked about, check that your suction's working, check your airway trolley, it's part of the anesthetic machine check, make sure you've got a working ambu bag, and make sure there's a defibrillator somewhere in theatre that's charged and ready to go. And that's all part of the equipment check in the perioperative phase. Remember that you can use these checklists. You'll see that all the things that I've mentioned, they're on this list. So just put it on the side of the machine or on the wall and use it when you're checking. And don't forget, if you're not going to do the full check, at least check these things: power, oxygen cylinder, suction, ambu bag, and circuit pressure. And use, when you get anaesthetists that come to your theatre, guys that come on outreach, or perhaps guys with a little bit more experience, use them to teach you to do the bits you don't know, like calibrating your analyzers, or if you want to know how to use a test lung, get these guys to show you so you become familiar with the machine and you make your anesthetics safer for both you and for the patient. Thank you.